You're live.
Okay. Hello, everybody. It's Dr. David. How you doing? Welcome to one of my favorite parts of my month, talking to everybody and getting to think on my toes and being able to share and educate people. So, thank you, everybody who is watching. And as we really asked to share this, obviously we put this video out in recorded sense afterwards. But please get people to join along with us. We love to hear from different people. We like to hear different points of view. For those who do not know, I am Dr. David Berger, a pediatrician in Tampa, Florida. Holistic pediatrics and family care is one of my practices. Holistic relief is my medical cannabis practice, and Dr. David MD, which is what you're watching this on, is my education health media company that we focus on health education and choices. So this is our monthly Ask Dr. David live that we do here on YouTube. And again, thanks just so much. Now, a couple of things. So I will be getting the questions live as they're coming into me. Shari is behind the proverbial glass window, and she'll be feeding me those questions. I also wish to point out that this is for general education, that this does not represent any type of specific medical advice for any one person. These are generalized things, and obviously everybody really has their own situation and has their own considerations. And so any more information really should be done in a consultation, which of course, whether you are in the state, and I do that through Dr. David, I'm through Holistic Pediatrics and Family Care or Holistic Relief, or through our Dr. David MD health education company for people who are around the country. Okay. Also, we first always take questions from people or answer questions from people who have submitted through our Patreon account. We do thank our Patreon subscribers and supporters for doing this. It does help keep our channel alive. So thank you so much. All right. Of course, we'll take questions from other people too. So Shari is loading up the first question here. So I should have this any moment. Okay, so somebody is asking this question on behalf of a family member. So when I'm looking over there, I'm looking at the question that is being posed. Okay, so this is asking about an adult male, not overweight, diagnosed with gout a few years ago, and who has been suffering with abscesses in the glutes, testicles, and more recently in the anus. So far, all doctors know is that hair follicles are getting infected and creating the abscesses. Each time he's gotten a round of antibiotics, surgically treated at the hospital, cleaned by a nurse until the wound is healed. Would like to research into what could be causing these recurring infections and what could be done to avoid them. Where do we start? Wow. Well, first of all, I'm sorry to hear that your family member is going through this. That really stinks. Certainly in my earlier days when I was in medical school, I did see patients who had some of these issues as well, and having to go through opening of abscesses and debridement. And, gosh, sometimes we had to put patients into hyperbaric chambers in order to help get their healing more under control. So having witnessed that, my heart really does go out to you and your family who's experiencing this. Now, a couple things come up for me right off the bat. And obviously, this may be somebody who would benefit from doing a face-to-face consultation with me or by video to really go through these things. But there are a couple of things that would come up for me. So first of all, do we know if this is the same bacteria that is being seen over and over again, or is it are different bacteria showing up each time? Obviously, assuming that they're looking at sensitivity panels to know which antibiotics work, because it does seem to be clearing it up. Sometimes antibiotics may be needed to use every now and then in a prophylactic sense. Of course, we try not to do that because we know that builds up antibiotic resistance. But of course, sometimes with the periodic exposure, we can keep things at bay. Okay. Now, of course, as I'm going to always want to know, does this person have optimized zinc and vitamin D levels, both the red blood cell zinc as well as the plasma zinc, as well as vitamin D? And as you've probably heard me talk before about aiming for the middle part of the reference range. So if it says that vitamin D should be between 30 to 165, 70, for different zinc levels, etc. So that's always my first question. But a second question that I have is, what type of immunological workup has been done about this patient? Have they looked at their antibody levels? Have they looked at the different types of white blood cells, natural killer cells? Are there any deficiencies that would indicate that there is an immunodeficiency that could be contributing to these recurrent issues? Okay. Now, that really be kind of where I would be starting at from this. And of course, looking at other areas of nutrition that, and what we do with our methylation genetic panel is all of those things that would give this individual the best opportunity, the best armament to fight this off. What is happening there? So, of course, there could be a lot more to it, but that's really kind of what I would be wanting to think about. I would say that if this person is having ongoing issues, that having hyperbaric therapy as part of a maintenance program could very well be helpful to them. I know that cost can be an issue. That availability could be an issue. Certainly we have patients who use the soft hyperbaric chambers that they rent and they can purchase and have it in their home for kind of ongoing use to do a few hours whenever they can. Technically an hour to hour and a half whenever they can in multiple sessions, to be accurate about that. So, but certainly these types of infections can be treated from that. Of course, other questions that I would be asking in terms of if this is of hair follicles, is there any ongoing prophylactic treatment of the skin of those hairy areas? There are things that are done when people have to go in for surgery. Before they go in for surgery, there's certain types of wipes that are being used in order to cleanse those areas. Perhaps there could be a regimen where a person is using that kind of local cleaning, since it does kind of being described here as a particular region of the body that's being impacted here, kind of up in there. So, maybe there could be some kind of treatment from that perspective that may prevent the bacteria from growing as well. So hope that helps. All right, our next question. Which exposes the patient to more radiation? A low dose radiation CT scan or an MRI machine? They say that MRIs don't have radiation, but appliances such as refrigerators and ovens emit a high level of radiation due to the electricity they use. So it makes sense that you would have some exposure being inside the MRI for so long. Since MRIs take a lot longer, i.e., increased exposure, would a low dose CAT scan be a better choice for less radiation? Also, how do you feel about contrast dyes? Okay, so first of all, I am going to make a little disagreement here. There is not high amounts of radiation coming off of appliances. There's very low levels. Now, of course, can people be exposed to long periods of times? We know that this comes off of cell phones too. That's why we tell people don't carry their cell phones here, as much as they can off of their bodies, and don't sleep with it under your pillow or right next to your head. But these EMFs do, obviously it's one thing because it could be in Wi-Fi as well, but that's obviously being transmitted. Some people will turn their Wi-Fi's off at night to avoid this. But my understanding is that these appliances actually, they do emit it, but I guess you're not living in one's refrigerator. You're not living in your oven. You're not really spending a lot of time up close to these. That it would be a problem. And I haven't really seen that be much of a problem. Now, as far as the CAT scan versus the MRI, my understanding is that you would not be getting much more exposure from an MRI being plugged in than to some of those other appliances. But as you probably know, this is using magnets and it's shifting the water and the ions around in order to make the image. Whereas a CAT scan is always exposing a person to radiation. By all means, thank goodness they have figured out how to do lower amounts of radiation now. And that's kind of something that is kind of universally done. Radiologists know about it, and the technology has improved to expose a person to less. And so, in my opinion, although I thank you for submitting this question ahead of time, because I tried to do some research on it, and the EMF type of exposure, that level of radiation, it's a different measurement, a different that is used relative to the amount of radiation that comes out of X-rays that come out of CAT scans. We are all exposed to radiation. When we are out in the sun, we are exposed to radiation. Flying in an airplane, you will get more radiation going from coast to coast than you will from an X-ray. So again, everything is relative. So of course, coming back to the question, why is this person needing a CT scan in the first place? Now, yes, they're typically done faster. An MRI, I meant to say. But, they tell us different things. So MRIs are typically done because they provide a much better image. Okay. And if you're really looking for something small or something more detailed, a CAT scan may not provide the level of imaging that is to be done. So, if personally, with me, I typically, talk more about MRIs if a person is able to tolerate it. Obviously, with some children, that can be tough. You are correct that the scans and the CAT scan is going to be a faster type of thing. And so some of my special needs kids, especially, may not be able to sit for an MRI unless they're sedated, which of course that brings a whole other question in terms of how a person does with sedation. But overall, I mean, I really haven't seen much problem with that as well. Now, so let me just make sure I got all parts of that figured out. Okay. Now, what do I feel about contrast dyes? Okay. So, of course, certain questions come out. Does a person have good kidney function? Are they going to be able to pee it out? Is this person well hydrated? And certainly, I would encourage anybody who's going to be going under contrast dyes to make sure that you're really well hydrated going into this, but also really well hydrated afterwards. As soon as you can, start flushing water, flushing things out, really just trying to get things out of the system. Okay. Now, for the most part, of course, people can have allergic reactions to contrast dyes. Not common, definitely seen it happen. Okay. But, obviously, the reason why this is done is for a particular reason, right? Because you need that in order to get the level of imaging. So, in particular, like if a person is using a contrast dye because of a concern about a tumor, okay, tumors are blood filled. They will much more take up contrast dye than surrounding tissue because of the fact of the increased blood flow that's going to a tumor. So you may not be able to get the level of imaging without the contrast being there in the first place. So again, without knowing what it would be, but certainly, it's pretty well established that you don't do contrast unless you need to do contrast. And then, of course, if you need to, then the pro versus con should be weighed. But certainly, whenever I order a contrast, one with and without contrast, it's because we need to look deeper to have a true understanding of what's going on. Hope that helps. All right, next question here. I recently read that even natural sweeteners that were believed to be safe can cause blood clots, heart problems, and other long-term health effects. What is your medical advice on using natural sweeteners like stevia, monk fruit, and erythritol versus natural sugars like black molasses, raw honey, and dates? What is your advice? What would your advice be for someone who is pre-diabetic versus someone with normal glucose levels? What do you personally use as a sweetener, as my sweetener choice? Oh, thank you for asking that. I'm happy to share. Okay, so for those who don't know, I did do a rather lengthy video that will probably go into more detail than what I'm about to share now because I may not remember every single thing here, but I will definitely approach your questions. So first of all, the recent research that had come out regarding those blood clots and other heart issues and cardiovascular, it was specific to erythritol. Okay, so for those who don't know, this is what's called a sugar alcohol. Okay, it does not raise blood sugar levels. It's not typically absorbed into the body, so much, but it certainly can be, especially when it's done in higher amounts. Now, typically erythritol is something that it can be used as a sweetener by itself, but a lot of times it's added to other natural sweeteners like monk fruit in order to give it more of the consistency of like sugar granules as opposed to like monk fruit, and I think with stevia as well, but I know for monk fruit, because that's what I've used more of, is more of a very, very fine powder. I mean, you open it up, it's kind of very dusty in a way. And also, monk fruit is incredibly, and some of these are just so sweet that they almost needs to be cut with something less sweet in order to make it palatable. I mean, I made a cup of coffee yesterday and I got a new product, used the smallest little scooper of the monk fruit, and oh my God, it was way too sweet for me. And so I had to adjust my dose today. But that's it. Now, in terms of stevia, okay, again, this is a safe substance with a couple of exceptions. And so this is kind of like a sidebar of interest. So this story goes back probably 15 years. And I may have even told on this channel before, but it was kind of part of one of my early understandings of how there could be unexpected toxins and things. So I had a patient. Actually, it was 3 different patients who, when I was doing heavy metal chelation testing and they were going through chelation therapy, and we would follow up on their urine to see how much metals were still coming out if we had lowered it. And all 3 of these patients started putting antimony out in their urine. Now, this is not something we typically see, high levels of antimony. We'll see arsenic, aluminum, mercury, lead, but we don't typically see antimony. And it was in a very short period of time, like within a few weeks. And so I kind of took notice of it, and I realized that they were all using one common product, which was a zinc liquid from Kirkman Labs. And so I contacted Kirkman, and they went through everything. They tested the raw materials. They couldn't find anything that had antimony in this zinc. But then they did a little further investigation, and they found it was in the stevia that was used to naturally sweeten the zinc. They then went out and tested a whole bunch of other zinc products that were on the market at the time, and like 80% of them had high levels of antimony. Couldn't figure out whether it was part of the manufacturing process. Was it being put in? We don't know. But it was there for different companies, which was kind of weird. This is actually what led Kirkman to going out and buying $1 million mass spectrometer in order to test every single raw ingredient, the inert ingredients, etc., before it would go into their main lab to prevent that from happening again. And that has been the reason why Kirkman became my favorite supplement company, because I knew that they were the only ones for sure, and now there have been a few others, but that are doing that level of testing to make sure that this didn't happen. Sure enough, we stopped the zinc. We put them on a powdered zinc that had nothing added to as well. Their antimony levels came down as such. So again, I do not know if stevia actually still has it in there, but any company should be doing a certificate of analysis every now and then on their product. And we can certainly be asking for any of these types just to make sure that there's no impurities there. Okay. Now, when it comes to and a lot of one of the issues now that we're seeing when it comes to what is referred in terms of some of the diabetes and some of the other issues is that with added sugar. Okay. Now, some of the natural sweeteners like natural honey, and it is still added sugars. Okay. And that can be a problem. Okay. Certainly dried fruit with dates does have a concentrated amount of sugar, as well, although it is certainly a natural sugar, and molasses similar to honey. And so I, have been one to feel that using sweeteners that are derived from fruit, as opposed to something that's more synthetic, makes the most amount of sense. As far as someone who's pre-diabetic versus normal glucose levels, that is, certainly, sugar is an issue for people with diabetes. So for those who don't know, I do have diabetes myself. Now, mine came about a little different way, because you may not know, I don't know how much I've shared about this, but approximately, guess it was 10 years ago, I was diagnosed with a pancreatic neuroendocrine tumor. We do not know how long it would have been there. I was experiencing some belly pain in my left lower abdomen. This was found on an incidental finding on an ultrasound, followed up by CAT scan, up in my pancreas. Was very far away from where the pain was. And the surgeons were like, we don't know, this could have been there forever, but it has a minimal potential for metastasizing and turning into more of a neoplasm. So we decided to take it out. But with that, because it was in my pancreas, there went most of my pancreas, leaving me in a insulin deficient state because I don't have most of my pancreas anymore. So everybody's different, but I can tell you that the amount of carbs and sugar in particular that I eat has a direct impact on how my glucose levels are going to be. Now, thankfully, I'm able to take a product called Saliqua, which is an insulin-based product. I do as a shot once a day, and that kind of keeps me stable, and I check my blood sugars every morning to make sure I'm okay. But I will tell you, I know if I have a little cheat that night, and maybe I decided that I wanted to be extravagant with some dark chocolate ice cream or something like that, it'll show up the next day. Even to a point where I kind of know if I'm going to have one of those, the family's going out for a birthday or something like that, I'll even give myself a little higher dose of the insulin in order to counteract that. So I kind of know what to do from that perspective. So I think that kind of covers everything there. But as I said, I'm pretty sure I did go into some other stuff in the video. So if you go back through our YouTube channel, it wasn't all that long ago that I did a deeper dive on this. Okay, so here's our next question. Oh, I think I actually may have just covered this. I have read mixed info on the effects of carbs and diabetes on diabetes and cancer. Some say that the carbs and sugar have no impact and that animal proteins and fats are the culprit, while others say the opposite. What is your medical advice on this? Okay, so I part of this to me still comes back to added sugar as opposed to natural sugars found in natural fruits, vegetables, etc. But as far as this now, it is pretty clear though that plant-based diets, as opposed to animal-based diets, or people who are carnivores, that there is inflammation more commonly seen with animal-based products. That's the reason why people have moved. For one of the reasons, obviously, there's ethics as well. Why people have moved to more plant-based diets. Why I've majorly cut down on my intake of animal products, and I haven't eaten any mammals for over I think it's 30 years now. Wow. And I mostly will eat fish. Occasionally I'll eat chicken, not often. But I did switch over for those kind of health reasons for that. So I guess it also depends on the quality of the protein that you're talking about as well. I think I may Oh, fats. It's also about the type of fat we're talking about here. Okay. When you're talking about saturated fats, trans fats, those are omega-6 fatty acids, even for some people, which is why we do our genetic testing to see about this, because some of those are more likely to promote inflammation. Whereas omega 9, which is oleic acid, that's which in olive oil, as well as omega 3 fatty acids, are not and polyunsaturated fats, they're not the pro-inflammatory. So the quality of the fat, the type of the fat, actually, not even the quality, but the type of the fat itself can make a difference in terms of whether you are promoting inflammation or, especially in omega 3s, even anti-inflammatory. And of course, we know inflammation is the root of all of this. If person's having diabetes or cancer, there's an inflammation component. Anything we could do to lower inflammation does our body good. Okay, next question here. What is the cause of recurrent 2 or more early miscarriages? If this happens, what investigating do you do? What alternative measures can you do to prevent early miscarriage? Wow. Okay. So this is actually something that I have a lot of experience with. I think it's the first time anything close to this was asked on the YouTube live. So yay for bringing up a new topic. Okay. So first of all, I don't necessarily would label 2 or more as for sure an issue. Okay. In all honesty, a lot of, I believe like 40% of conceptions, if my numbers are correct, actually don't take. Okay. Sometimes it doesn't take before the first month, and a woman will have a period or a mini miscarriage with, not mini, I guess a miscarriage is a miscarriage, where there's bleeding and they don't even realize that they were pregnant in the first place. Okay. So that can happen. Okay. Now, why do miscarriages happen? Usually there's one of 2 reasons. Number 1, some type of genetic abnormality when the chromosomes met, when things went bump in the night, that that there was a chromosomal abnormality. Of course, there are certain chromosome abnormalities like trisomy 21 Down syndrome that are very compatible with life. Of course, many people with trisomy 21 live on to have very full and productive and wonderful lives. Although some, because of how impactful it could be in the developing body, such as, some will have small holes in the heart, some can have very, very impactful, improperly formed hearts, which may not allow them to actually get to birth. But there are other trisomies like 18 and trisomy 21 and other very rare genetic conditions that the body recognizes this is not going to be compatible, and kind of it just shuts it down. So that would be one of the questions that I would be asking him. Certainly, we did go through some of this with as part of our family planning throughout the years. And so, of course, doing, if one's able to collect the miscarried tissue, that there could be genetic testing that is done on that to see if there was some chromosomal abnormality or whether it was not. Now, the other main reason, and again, this is not including like a trauma if someone got hit to the belly or fell down the stairs, God forbid, or had a car accident, but the other main, I guess you could say physiologic, is blood clots. Okay, and microclotting within the placenta that can starve off or lead to demise of the fetus because of that. There are 2 main reasons why this can happen. There are genetic reasons, factor 5. There's factor 5 laden, there's protein C, protein S deficiencies that can lead to what we refer to as a hypercoagulable or clotting state. And then there's also what is referred to as acquired, which is typically an autoimmune situation. You may hear the term the antiphospholipid syndrome. Okay. And you'll hear about antibodies like the antiphosphatidylcholine, antiphospholipid, anti-beta cardiolipin. I think there's one more that I'm forgetting. And any of these can also lead to a more hypercoagulable state. Okay. Now, those are all antibodies that one can test for in blood. Those are very mainstream tests. But if a person is really having more of a clotting issue, then there are things that we can do, heparin shots that can be done as when a person gets pregnant in order to not allow that to happen, to keep the blood from clotting. Okay. Now, in addition to that, there could be some other things that are going on. Oh, one of the other reasons, and I forgot to mention, some people, some women do not produce enough progesterone. Now, as you know, the uteral lining starts starts to thicken after there is a menses, after there's a period, to start building up the lining of the uterus in order to accept another conception if it were to happen. Okay. And so we know that around the time of ovulation, right afterwards, that becomes thickest. And then we know that if there is not a conception, if there's not an implantation, then the body knows, oh, I don't need this thick uterine lining anymore. And then it sheds. And that's the period that happens because the progesterone level drops. Progesterone promotes gestation, progesterone. Okay. So one of the things that I also will do if the person has had multiple miscarriages is, as soon as they are pregnant, they have a positive pregnancy test, within 48 hours, I recommend checking a progesterone level. There's a certain range that we know. Some people say 15, some people say 20, but there is a range that is needed to maintain that continued promoting of gestation, of the thickening of the uterine lining, the eventual growth of, as the placenta starts to grow, the developing of the umbilical cord. That all needs to have that hormonal stimulation in order for this to happen. So if a person is running low in their progesterone, we immediately start giving them progesterone as a supplement. And then we retest the level 48 hours. We make sure we got it. Sometimes we need to bump it, and we will do that again. And then usually that's something that we will maintain at least through the first trimester. And then what I'll typically do is we'll stop it, but then, I'll get a level just to see where we are. And then kind of like a new baseline. We'll stop the progesterone, and then a few days later, we'll check it again to make sure it hasn't gone down. Usually by then it has not, because by that point, the placenta itself is making its own progesterone. It's not just being acquired through the, through the ovaries. And so there is that additional kind of takeover. And then usually if that's okay, then we'll go forward and we'll leave it at that. But a lot of times if we're using the blood clotting treatments, the reversals, that will also typically go at least through the first trimester, depending on a person's history. And a lot of times at that point, we're consulting with a maternal fetal medicine specialist to also get their feedback. Of course, ultrasounds looking at the health of the placenta, location of the placenta, make sure it where it needs to be. Of course, those things are coming through. And we want to make sure that if a person, that if we can maintain this healthy pregnancy. Now, fortunately, we've had a lot of success with this. Okay. And, we just kind of learn. It's like this little, like a flow chart that we've put together, that I just know, okay, we got to check this. We got to check this. We got to check this. We have to treat this. We have to follow up this way. Okay. My 10-year-old needs a palate expander for 6 months to make room in his mouth for some adult teeth. We already have had to extract 4 baby teeth and will extract 2 more teeth, but the expander is still needed. The palate expander is made of stainless steel, and I'm worried about heavy metal exposure. What are your thoughts on heavy metals from palate expander? My understanding is that stainless steel is not a problem, that it's not giving anything off. There are certainly other dental appliances and not even appliances, but some of the older dental sealants, concerns about BPA, etc. But my understanding, and this is also why I recommend either stainless steel and not aluminum, not Teflon, but yes, could do cast iron. And from a cooking perspective, my understanding is that there is not a giving off of metals, of those heavy metals, when doing it as stainless steel. If you have any other information about that, feel free to send it over. I'd be happy to look at it afterwards. But my understanding is that that's why that material is used and why it's so strong. Obviously, because it's stainless steel, but that is not really considered a problem. Of course, this is something that people would not be having in their mouth forever. It's there for a particular reason. Yes, removing other teeth can sometimes help as well, but it sounds as if that's not an option for you here. right? I guess if you really wanted to be concerned about it, one could do heavy metal testing beforehand, and then maybe a month afterwards, we could do heavy metal testing again to see if anything's actually showing up. That may be the most sure way that you know that you're not ongoing for those 6 months of exposing somebody to something, if the question of the risk versus benefit is still being contemplated. Okay. I have been hearing about Candida auris spreading in the country. What is this, and should I be concerned? Okay, so this is kind of hot off the news, and I was actually asked by a TV station today. So I don't know. You never know how much of what my quotes end up in a news story, but I was actually asked about this today, and if it's anything that they put forth, we'll post it to our social media. Okay, so Candida, let's first talk about that. This is a common type of yeast that humans get. Okay, when a person has a vaginal yeast infection, that's typically Candida albicans. When a baby has oral thrush, that too is usually Candida albicans. Now, this is a cousin, Candida auris. Okay. Now, this is an emerging thing. It really wasn't even known about until this millennium. There is evidence that it may have been identified when looking back at older cultures back to the 90s. But this is not something that is been around for a long time. Whereas Candida and the bacteria and stuff like that, that is well known. But this is a fungus. Now, this particular fungus has been spread in mostly healthcare and hospital settings. Okay. Now, people who have good immune systems, and we know some people naturally have good. We've talked about how we support our immune systems. But people who have good immune systems, this really is not an issue. Healthy people do not get this. Who would I be more concerned about? People who are taking chemo, people who are older, who may just over the aging process not have as strong of immune system, people who are who are immunodeficient for other reasons. So that would be like really the subset of people that would be more at risk of this. Now, Candida auris also, it's not spread through the air. So you don't have to worry because you walk into a hospital that you're going to do it. It's through direct contact, and often more through like open wounds, or if there's a scrape, right? And so, there are precautions, especially with the CDC now putting this warning out. So all hospitals should be aware of this and should be taking precautions with proper cleaning. Now, regular Lysol types of cleaning doesn't kill it. It has to be something that's bleach based. So lovely for that smell, right? But that's really considered the main thing from a surface perspective that a person can do. So we're talking about, also not sharing equipment from person to person. Like, so, most modern hospitals now have one blood pressure cuff for that one patient. So if they're moving around from patient to patient, that would be more of a concern. Now, the other main concern here is that most of the antifungal, anti-yeast medications that are used for treating Candida albicans, jock itch, etc. The fluconazole or other azole antifungals, or terbinafine, which is Lamisil, or nystatin, they don't work against this. That's the problem. There are certain, it's called echocanthins, I believe. Candins are the name of the category. It's only done by IV. So obviously, this is like people who are in hospital who may need something. So the most common symptom associated with the symptoms are high fevers and shaking chills. Okay, which of course can be a sign of pneumonia or a bacterial infection of other sorts. And of course, if a person is put on an antibiotic while they're trying to figure out and no bacteria shows up, or antibiotics are not working, then you have to be thinking about this. And that makes sense. And then they may need to kind of do further cultures. But here's the thing: yeast is very sticky. This Candida is very sticky. So the issue is that it could stick to, say, a heart valve, and that potentially can cause valvular problems and heart issues. It can stick to other areas of the body and cause problems wherever that is. So that's kind of more the secondary problem that can happen, is where does it end up? It could end up as an abscess or kind of a skin infection, especially if there was a cut and that's how it got in. So really, it depends on where it is located is going to be the problem. Do I think we need to be worrying about this? I do not. Okay. There has been, hundreds, I think, or less a number of cases so far, but it's just something to be aware of. And if you have a family member who's going into a hospital, you're going to the hospital, just verify with the hospital staff what precautions are you taking to prevent this. Of course, hopefully they would be taking precautions anyways. Of course, if a patient does test positive, they should be isolated, similar to the way people were done originally for COVID, but lots of other infections, MRSA infections. There's a certain amount of universal precautions as well as specific precautions that should be done when a person has this as well. Okay. Gummy vitamins. Are they real vitamins or pure sugar? Okay. Well, most of them are sugar for sure. That's kind of what makes a gummy. Although I have seen some that are less. And looking at packages. So when you look at the package label, it should, besides listing all the nutrients, should also say added sugar. And I have seen a very wide variety. And some of them are just like maybe, some of the problem, maybe just with fruit juices as opposed to added sugars of table sugar. Okay. So when you look at the label of the back labels of these products, first of all, it's not very common that a multivitamin will have high amounts of the nutrients. Some do. But if you look at a lot of the products that are out there and you compare them to what's in other types of tablets or capsules, you'll see that it's a fraction. So make sure, just because it says it has everything from A to zinc, that how much it's those numbers that make a difference as well. Okay. Now, of course, a good company should also be doing a certificate of analysis that would third party document that what says on the label is what it's and actually inside the product. And a good company should provide that for you. A good company should be testing every single batch and be able to tell you for the particular batch that they're selling what their analysis shows. If a company didn't do that, that would make me wonder why. Are they not spending the time, the money to do it? Do they know something that they don't want you to know? I don't know about that, but there is ways of doing your due diligence in order to figure out, in fact, does this product have what I want and does it not have what I don't want? Right? Okay. Early in this episode, you mentioned you trust Kirkman products and why. Other than Kirkman products, were some of the other brands that you would recommend? Okay, so there are a couple companies that I'm more comfortable using. I do use Pure Encapsulations a bit. I use Thorn a fair bit, Vital Nutrients. In terms of fish oils, I do use a lot of the Nordic Naturals products as well as the Zymogen products. The Zymogen overall, I like them as well. There are, from an over-the-counter in the health food stores, I'm more comfortable using products such as the Now product line or the oh, I just had a brain fart. I'll come back around to it. I'm sorry. Um what is the other one? And but for other ones, it could be very specific. So, for instance, I may use a particular herb from a particular company because it's a standardized extract where they're measuring and documenting that the active ingredient is there. Okay. Sometimes you'll look at herbal products in particular, and it may say that it contains 400 milligrams of leaves and stems and seeds. Well, that doesn't really mean that you have 400 milligrams of an active ingredient. That means it's just whatever got pulverized and got put into a capsule or into a tincture. So that's one of those things as well. In terms of herbal tinctures, I've always had a preference for the Gaia line. I like the fact that, besides the fact that they seem to be really good potency, and I've had a lot of consistency with them. I like that they do have a fair number of products that are in the glycerin base as opposed to an alcohol base, which of course makes it more palatable to to kids, especially. Nature's Way, I'd say that that's a company that I've used some of their herbs more than other companies as well. Next question here. What do you think about raw milk? Any health benefits? Okay. So raw milk is obviously breast milk, right? Big fan, right? We all, all babies should be given breast milk for as long as possible. I realize that's probably what you're talking about, but it is raw milk, right? We need to be aware of that. Now, if you're talking about raw milk because you have a cow or a co-op where you're getting fresh milk on a daily basis, I think that that's great. Okay. There's always the question of what's happening between udder and table. If it's being sold at a store, how much time is there in transportation? Of course, the main concern would be contamination. Okay. And obviously, if you open up something and it smells off, then you know for sure it's off. But of course, there could be smaller amounts of bacteria or other things that just haven't gotten to the point where it's rancid yet. Okay, but there definitely are health benefits when you pasteurize milk. You're breaking down the, like the immunoglobulins, just like what's found in breast milk. There are antibodies, immunoglobulin IgA. That's found there as well. In fact, one we actually can use organic colostrum from a cow to increase the antibodies. And sometimes we will test people who have recurring intestinal issues, and they may have low secretory IgA in their gut. And if they can't get breast milk, then using cow colostrum, there's even one of Kirkman, since we're talking about them, they actually filter out a lot of the cow milk proteins, although there can still be traces, but there's a lot less than in other products as well. So, so in terms of the proteins, obviously milk does provide proteins, fats, and liquid and calcium, right? That's all good stuff. That it should be there. But to me, the main benefits is that the things that are naturally would be found in milk and found in breast milk would be there in raw cow milk as well. Oh, and I guess we could also not just talk about raw milk, cow milk, but of course, goat milk. That's, for those who don't know, and I don't understand why, but goat milk is actually closer in its constituency to breast milk of humans than it is to cow milk. You'd think farm animal, hooved animal, four-legged animal, but for whatever reason, goat milk. And so that's why a lot of people are able to tolerate or even just choose to switch over to goat milk as opposed to going to cow milk as well. So there can, of course, if you have your own goats or have access to raw goat milk as well, we know that people do that with camel milk as well, which I know that's something that probably people listening here have heard of it. Probably most people in America have not, or get really weirded out with that. I certainly wouldn't want to be the person to milk a camel. If you've ever hung out with a camel like I did when I was in Israel, they are not the nicest of animals. They kind of get a toot and they can spit at you and all kinds of stuff like that. But the thing about camel milk is it seems as if there are certain factors similar to the others, but even in a more sense of really powerful anti-inflammatory properties that can help reduce inflammation. So any kind of raw milk will have that, but camel milk, it seems to be getting a little bit of thing. But again, I've never talked it really about any kind of sheep milk or porcupine milk or any other mammal. But those are the kind of things that I've had experience with. Next question. Pardon me. What do you recommend for? Pardon me for 1 second. Excuse me. What do you recommend for gastritis? Okay. Well, first of all, gastritis is a general term. Okay. Itis, inflammation, gastro of the stomach. Okay. So, of course, a person can get gastritis from taking too much ibuprofen. A person can get gastritis from their stomach acids, right? A person can get gastritis from an infection, right? So part of the question would be, what is the cause of the gastritis? Also, is this an acute gastritis like that you caught from a virus? Is this a chronic gastritis that's going on? So really, it depends on what the type of gastritis is that we're talking about, right? So obviously, if it's a medication induced, one needs to stop that medication, right? Now, if we're talking about things in the peptic ulcer disease or the GE reflux kind of acid disease and gastritis there, there's certainly, maybe looking at certain foods to deal with. You might need to take an acid blocker, whether it's Tums or other calcium product, or even like a short term for this. We don't like to use any of the H2 blockers, which is like the Pepcid and Zantac, or the stronger Prilosec. And those really should never be used long term. And although it's used a lot of long-term by doctors, but it is no indication or safety that that's there. But if a person had to, because it was an acute gastritis, to take something like that just to kind of, calm the acid down, neutralize the acid in order to let things heal, that's certainly something. Now, there could be certain foods that are triggers. An elimination reintroduction diet can often find that. Sometimes people, again, in the acid world, and this is kind of a contradictory thing, but taking betaine hydrochloride, which is also which is a form of TMG, but betaine hydrochloride, there is a belief that actually giving more acid under the controlled situation can help turn things down and control those types of symptoms as well. But again, if we know more about what the type of gastritis is, we could give other more directed answers or really narrow it down as to what the direction should be. Oh, one other thing in terms of infections, because as you probably know, one of the more common reasons for infectious chronic gastritis or ulcers is a bacteria called Helicobacter pylori. There are tests that one can do to check. There's a breath test that one can do to see if there's evidence of a marker there in the breath. If that's the case, although there are some natural antibiotics, I haven't had a lot of success. There are some successful oral antibiotic protocols for this bacteria that can be used. So, of course, if Helicobacter pylori is the known cause, then there are specific things for that as well. What calcium supplements do you recommend for kids? And can calcium supplements cause heart issues? Okay. So, first things first, it's kind of come back to some of that companies that we were talking about before, because unfortunately, there has been an issue with calcium supplements and lead. Okay, so again, people should be testing, making sure that their products are being tested. Again, why I prefer Kirkman. There is another product that I use. It's from a company called Phytotherapy. They have liquid calcium gel caps. The thing I like about that, it's got multiple types of calcium in there, plus other things to build bone, like boron and horsetail, magnesium, vitamin D. I think that's all the ingredients that are in there. So those are the types of things. But of course, I prefer to get it through food, right? And so, of course, if one's trying to avoid dairy for whatever reason, the plant-based milks, although you do want to make sure that the plant-based milk that you're choosing has calcium in it, you have to look at the back label. A typical product that has a good amount of calcium will have anywhere between 25 to 45% calcium. But if you look at some of the products, it'll have like 1 or 2%. So you really have to look at the labels in order to make sure from that, as well as any other type of dairy substitute. Now, in terms of calcium supplements causing heart issues, there's a but, yes. Okay, which is when a person is taking a lot of calcium, including when they're taking it with vitamin D, calcification is one of the things that is part of the inflammatory process, along with cholesterol, that builds up plaques. Okay. Now, when a person is taking vitamin K, in particular vitamin K2 called MK7, which is something that we are now actually recommending being taken, there are supplements that have vitamin D3, K2 in it. That seems to neutralize that. That decreases the calcifications. One of the things that I also do as in adults, as they get closer to concerns of ages of cardiovascular disease, is there's actually a CAT scan called a calcium score. Now, this can pick up building up plaques and inflammation way before it would be seen on an echocardiogram where there'd be a significant amount of blockage. So a perfect calcium score is a 0. Yours truly has a 0. Yay. And depending on how high that number is, there's more of a risk factor as well. And that could even dictate whether, what kind of changes, whether it's lifestyle or even, if it's really bad, should a person be on an anti cholesterol and kind of medication or other things as well. So it's not that the calcium itself is causing the problem. In fact, calcium is needed every time a muscle in our body contracts. That's including our heart. So if we didn't have calcium, it would not be compatible with life. Not because we would have weak bones, but our muscles would not be contracting. And in fact, part of the reason why we want to make sure that people get the proper calcium intake, when a person does have good vitamin D levels, they do not need to be taking 100% of the RDA. They could probably get away with 50 to 60% just fine. There is a blood test one can do called an ionized calcium, which is different than the serum calcium that's found on a typical liver kidney profile. But those two tests can tell you whether things are in range in the bloodstream. Okay, but by making sure that the calcium is enough in the diet, because what happens, since your body knows it needs calcium for muscle contraction, if you're not getting enough calcium through the oral route, through the diet, your body will take it out of the bones in order to keep the blood levels in that certain range, in order to feed your muscles, including your heart. All right, let's see if we have any. Well, then wow. Hi, can you please share with your audience what supplements you take on a daily basis? Sure. Getting personal here today. Okay, so I do take a daily adult multivitamin. I do take the Kirkman product. Um, I take vitamin D daily, 10,000 units, but I'm doing that based upon my blood levels. I know I've shared before that I had a terribly low vitamin D level when I started with the 16. I now run in the 70s, taking 10,000 a day. I needed 15,000 originally to get myself up. And I think I may have mentioned in the previous show, when I got my vitamin D level up to 70, that's when all my allergies disappeared and my asthma, except for my exercise-induced asthma. So I take something before I exercise in terms of inhaler, but I don't have those problems anymore after suffering for over 30 years before I figured out this product. I take glutathione every day. The the antioxidant, anti-inflammatory, probably something we all should be on now. I do also eat a tremendous amount of broccoli. Okay. I would love to know if there's somebody who eats more broccoli than I do. But the sulforaphane, the sulfates in there, that's also part of what's needed for glutathione and for that anti-inflammatory effect. Because I have a chronic shoulder issue from a torn labrum, I do take a form of curcumin, a brand called Enhancer from Lee Silsby. I do take 600 milligrams of that every day. I typically take one fish oil capsule a day of 600 milligrams to 780, depending on which one I have. I typically use the Zymogen product. I like that they're also enteric coated, so they don't give the fish burps. But if I'm eating a good amount of fish, salmon is really the only fish that I do eat. But I don't necessarily, if I have if I've eaten 4-8 ounces of salmon, I don't necessarily take my fish oil supplement for the next few days after that. Running through my cabinet in my head here. Oh, my D3 does have K2 in it, of course, to say about that. I do have a prostate issue, so I do take saw palmetto on a daily basis as well, and that really seems to be helpful there as well. I think that is all of them. It is definitely possible that I miss one. Once a week I set up my pills in my pill box and I take them all out, and then I kind of just pop my pills as I go. But I think I got it all there. All right, and that was the last question. Wow. I'm sorry. There is one last question that just came through. I thought that was Shari saying that was the last question, but I am not right. Okay, so as a member of so this is from a person who says, as a member of the LGBTQ community, celebrating Pride in Florida this month couldn't have come at a more appropriate time. Our community is under attack. And to be honest, I fear for myself and others that violence against our community will only increase with all of the falsehoods and rhetoric being spewed by the politicians like our governor. I appreciate that you have been more vocal lately on trans issues, especially on YouTube and TikTok. For people who don't have these types of public platforms, how can they be effective allies of the community? Okay. So there's a lot to this. Now, of course, something that we all could be doing is writing to our legislators, telling them what you feel about this, writing letters to the editor, communicating with news channels about, maybe you can make a statement, maybe they can use you in a article because this is in the news a lot. Okay, so that's certainly something. Rallying, right? Protesting, peaceful protesting. Maybe if they're, protesting in a legislator's office who may be perpetuating these what I would refer to as injustices, these prejudicial actions being taken against the community as well. Now, of course, another part about is not just saying that somebody's an ally, not feeling for them, but sharing with people in the community. Is there anything I can do to help you? Is there anything I can do to support you? Is there anything I can participate in with you? Okay. At our synagogue this past week, we do once a year, we do a pride service on Friday nights at our Shabbat service, of which I actually wrote the words to, so I'll take the Hebrew prayers, the words themselves. And one of the things that I do, not just for this, but I'll typically change the tunes around in order to kind of make it more updated or just something that people would appreciate. So this time I actually took the prayers. I took some of the tunes written by LGBTQ artists, and I used their tunes in order to do that, to share it with our community. Okay. I will be going down to Ybor City this weekend to participate as an ally for the Pride festival and then parade that's going to be happening there. But another thing that people can be is also being mindful of the words that we speak. Okay. Sometimes they can be innocuous. Like I know, for instance, that, at the gym that I go to, which is a class gym, sometimes they will say, hey, guys, be focusing on this and ladies be focusing on that. Well, you know what? Not everybody who's a biological female may consider themselves a lady. So, do we need to be differentiating that in the first place? But, we can be also using more gender neutral terms. That's different than a particular person's, how they wish to gender identify, right? But using more general terms, as opposed to things that are specific to a gender, can also just be more less potentially effective, insulting to somebody else if you're using those words that so many people don't even realize that we use. But that is something, and I know I'm guilty of it, but it is something that, as I have become more mindful in my speech, that I really, whenever I can, to try to use those types of terminologies. Even before I didn't just mention women who are pregnant. I referred to a person with, we talked about how a uterus goes. Okay, obviously you can't be pregnant or have a miscarriage if you don't have a uterus in the first place. So that's a way I can physiologically or anatomically speak about something like that. So really, this is something that is so important because people in the community, they feel marginalized. We know that when you feel marginalized, left out, that you're being attacked. We know about the depression, the anxiety, the suicide risks, the suicide attempts as well. Okay, one can donate to places like the Trevor Project and other organizations that are advocating for and supporting mental health for people of of the community as well. So really, I'm a physician. I take care of patients of all shapes and sizes and all places along the gender scale and all places along the political scale and everything, religious scale, etc. I look at each person in their own individual sense and I respect them. And I have patients who are being hurt by these policies. I have patients who have come to me who have attempted suicides because of this, because they feel that they're not being respected, they feel that they're not being listened to, they don't feel that they have a place to go. They aren't necessarily even feeling comfortable going to schools now that we know that the Florida government is and the legislators and the governor is trying to ban just use of pronouns in schools, making it illegal for them to be used. You know what? I fail to understand how that is hurting anybody, but you know what? It's respectful for the person to want to be called and referred to with who they associate with. We've seen all the book bannings. We've heard about not being able to talk about certain subjects in schools, etc. And every one of these things is an attack on this community. People who are doing it may not think that they may be thinking that doing something glorious and moral or whatever they think it is, but put yourself in somebody else's position and ask yourself, how would I feel if I was that person and I heard this being said? That's really, really important. Put yourself into somebody's position. I do that every day. I feel it's the best way for me to connect with somebody, to understand what they're going through, to maybe see things from a different angle that I hadn't seen before. So there's lots of things that a person can do as an ally. There's lots of things within the community that we can do. And of course, if there is anybody in the community who is feeling and these negative thoughts, please seek out professional help for that. There are things that we can do to support you. There are ways that we can really help out. Okay. Now, one other thing. There are people out there who will even use transphobic or homophobic statements. If you hear that, another thing you can do, call them out for it. They may not realize that they did it, but they did. Or maybe that it's intentional. And you know what? Thankfully, in our society, more people are aware of it. But if you hear somebody who's using an offensive term, just as if you may hear somebody who's using a racially insensitive or a term for them, or a religious term, right, that is biased, that should be called out too. So this should kind of be a similar thing. Okay, so wow, that was a lot. We went an hour. That was longer than we have been going. So thank you, everybody. We've had some really wonderful and different questions. Again, we'll be doing this next month, and I look forward to sharing, hearing what you have to share with me and answering them. And of course, please share this with everybody. If you are not subscribed to our YouTube channel, please do so. Please subscribe and be a member of our Patreon to, again, continue to support this work. Have a great day.